Welcome back to the Deep Dive. Today we're getting into something almost every parent or caregiver faces, and honestly, it can cause a lot of stress. Baby rashes.
Oh, absolutely. If you're looking after a baby, chances are you've seen them, maybe done some late night Googling.
Definitely done the late night Googling, wondering, you know, is this serious? Should I be worried?
Right. And it's incredibly common. Our sources point out that something like 40 to 50% of babies get rashes in their first few months. It's huge.
Wow, nearly half. So let's start right there. Why? Why are babies so prone to this compared to, say, older kids or adults?
Well, it really boils down to their skin development. Baby skin is it's thinner, maybe 20–30% thinner than ours.
Okay.
And that protective outer layer, the skin barrier, it's much more delicate. Plus, their immune system is still figuring things out. It's underdeveloped.
So they're less equipped to handle everyday irritants.
Exactly. Things that wouldn't bother us can easily cause a reaction for them. Minor stuff, even infections.
Got it. So our mission today then is to help you, our listeners, cut through the confusion, to look at those little spots or bumps and have a better idea of what's going on.
Yeah, to help you recognize the signs, know what you can likely manage at home versus what might need a doctor's eye.
Right, because knowing that brings peace of mind, helps the baby feel better faster, and prevents things from getting worse.
So let's try and do some rapid-fire understanding here. First, what even is a baby rash, technically?
Good point. It's basically any kind of skin irritation, right? Redness, bumps.
Uh-huh. Caused by all sorts of things, environment, physiological stuff like hormones, maybe allergies. And that delicate, thin skin barrier we mentioned, that's the real key factor.
Okay, so that thin skin, it sort of gives us our first clue, maybe, like where the rash appears.
Absolutely. Location tells you a lot. Think about the face. It's constantly exposed, isn't it?
To saliva, drool, maybe leftover milk.
Exactly. So you see things like drool rash quite often there, or baby acne, sometimes eczema starting on the cheeks.
And what about other common spots? Like areas where moisture gets trapped.
Precisely. The body folds are prime real estate for rashes. Under the neck, armpits, the diaper area, of course, even the chest sometimes.
Because there's less airflow, more moisture, maybe friction.
That's it. So conditions like diaper rash or heat rash, love those spots. It's almost predictable.
Okay, so location is clue number one. Now let's get into the nitty-gritty, decoding the common types. The sources we looked at highlight 6 main ones. Let's stop calling everything that red bumpy thing.
Right, let's differentiate. Appearance and location are going to be our main guides here. How about we start with 2 really common ones often linked to the environment? Heat rash and diaper rash.
Sounds good. Heat rash first. What are we looking for?
Heat rash, or miliaria, happens when sweat glands get blocked. So sweat gets trapped under the skin.
Oh.
It usually looks like tiny red bumps, sometimes a little clear or fluid-filled blisters. You typically see it on the neck, chest, back, or in those skin folds we talked about.
And the cause is heat and humidity. Tight clothes.
Pretty much. Anything that makes the baby sweat more and blocks those glands. The key for treatment is actually keeping the baby cool and dry.
So loose cotton clothes, maybe a cooler room.
Exactly. And importantly, avoid heavy creams or ointments in that area because they can block the pores even more. Let the skin breathe.
Okay, that makes sense. Now the classic diaper rash.
Ah, yes. This one is pretty obvious by location, redness and inflammation right in the diaper zone. Buttocks, thighs, groin.
And the culprits.
Usually it's prolonged contact with wetness, like urine or stool. Friction from the diaper rubbing against the skin is another big one.
I've also heard changes in diet or even antibiotics can trigger it.
Yes, definitely. New foods can change the stool's composition, making it more irritating. Same with some antibiotics.
So managing this one, the sources seem really clear.
They are. Frequent diaper changes are number 1. Keep the area clean, but gently. Pat dry, don't rub.
And use a barrier cream.
Essential. Something with zinc oxide or petroleum jelly. It creates a physical barrier between the skin and the moisture. Protects it.
Got it. Okay, moving on. What about rashes that stick around a bit longer? Let's talk about baby eczema.
Right, atopic dermatitis. This is different because it's often a chronic condition, sometimes with a genetic link.
So not just a temporary irritation. How does it look?
It typically presents as patches of skin that are dry, scaly, red, and often very itchy.
Itchy's a key word there.
Absolutely. It often starts on the face cheeks, forehead, or the scalp, but then can spread, especially to the crux of the elbows and knees as the baby gets older.
What triggers it? besides genetic?
Things like harsh soaps, detergents, maybe dry air, even certain foods sometimes. The main things that differentiate it are that it persists, it's really dry, and it itches. It's not like heat rash that comes and goes quickly.
Okay, now something that looks maybe a bit alarming but usually isn't. Baby acne.
Yes. Looks like little pimples, red or white bumps, usually pops up on the cheeks, nose, forehead.
But it's not like teenage acne, right?
No, not at all.
Yep.
It's thought to be caused by leftover maternal hormones stimulating the baby's oil glands. The good news is it's totally harmless.
And it goes away on its own.
Yep, usually within a few weeks or months. No special treatment needed, just gentle cleansing. And crucially, it doesn't typically itch.
That's a relief. Okay, next up, cradle cap.
Seborrheic dermatitis. This one's pretty distinctive too. You'll see greasy, yellowish, scaly, or crusty patches, mostly on the scalp.
Like little flakes or scale?
Yeah, sometimes quite thick. It can sometimes appear on the eyebrows or behind the ears too. It's not totally clear what causes it, but it might involve overactive oil glands and a common yeast called Malassezia that lives on the skin.
Is it itchy like eczema?
Generally, no. That's a key difference. It might look a bit unsightly, but it doesn't usually bother the baby.
And how do you deal with it?
Gentle washing with a mild baby shampoo helps. You can also try softening the crusts first with a bit of baby oil or petroleum jelly. Leave it on for a bit, then gently brush the flakes away with a soft brush before shampooing.
Okay, gentle removal. And the last of the big six, drool rash.
The name says it all, really. It's that red, sometimes bumpy, irritated skin you see right around the mouth, on the chin, maybe down onto the neck.
Caused by constant drooling.
Exactly. Especially common when babies are teething and producing tons of saliva. The constant wetness irritates that delicate skin.
So the solution is just keeping it dry.
Pretty much. Vigilance is key. Gently wipe away drool. Frequently don't rub, just pat. And applying a barrier cream like petroleum jelly or lanolin can be really helpful to protect the skin from the moisture.
Okay, so we've got heat rash, diaper rash, eczema, baby acne, cradle cap, and drool rash. That covers a lot.
It does. And now that we can sort of picture these different types, maybe the most useful thing for you as a parent or caregiver is figuring out, is my baby actually uncomfortable? Is this itchy or painful?
That's a really practical point, because some of these look worse than they feel, right?
Exactly. That itch factor is a huge clue for how urgently you need to act and what kind of relief to focus on. It helps you triage.
So let's split them. Which ones generally don't itch?
The non-itchy crew usually includes baby acne, cradle cap, most cases of heat rash, and drool rash.
So for those, the main strategy is keeping the area clean, dry, cool, using barriers where needed, and basically just giving it time. The baby isn't usually distressed.
Precisely. If they're not scratching or seeming bothered, you can focus on that gentle, specific care for the area and usually take a breath.
Okay, so which ones are the itchy ones, the ones that make babies miserable?
That's primarily eczema. It's known for being intensely itchy. Also, acute allergic reactions like hives or contact dermatitis from something they touched, those can be very itchy too. And insect bites, of course.
And those itchy ones need more active soothing, right? Relief becomes the priority.
Definitely. Because the itch disrupts sleep, makes them fussy, and scratching can break the skin and lead to infection. So you're looking at things to calm the itch itself.
Let's circle back to triggers. We mentioned moisture, friction, heat. But what about less obvious things, stuff we use every day?
Yes, the sources really emphasize looking at potential irritants and allergens in the baby's environment. Think about skincare products and laundry detergents.
Like the fragrances and dyes.
Exactly. There's perfumes, dyes, harsh chemicals found in many standard soaps, lotions, bubble baths, laundry detergents. They can easily penetrate that thin baby skin barrier and cause irritation or flare-ups, especially if the baby is prone to eczema.
So even residue on clothes washed in regular detergent could be a problem if someone's holding the baby.
It absolutely could. That's why hypoallergenic, dye-free, fragrance-free products are so strongly recommended for anything that touches the baby's skin, their clothes, bedding, your clothes.
What about the fabrics themselves?
Good point. Some materials can be irritating. Synthetics might not breathe well, trapping heat and moisture. Wool can be scratchy and cause mechanical irritation.
Even things like metal snaps on clothing.
Yeah, some babies react to nickel and snaps or zippers, causing a localized contact dermatitis. And don't forget dry air, especially in winter or dry climate.
How does dry air contribute?
Dry air pulls moisture out of the skin, weakening that protective barrier. This makes the skin flaky, more vulnerable to irritants, and can definitely trigger or worsen eczema.
Okay, lots of potential triggers to be mindful of. Let's shift to managing things at home. For those milder, non-itchy, or even mildly itchy rashes, what are some safe, accessible home remedies?
There are some good, gentle options. An oatmeal bath is a classic for soothing, itchy, inflamed skin, think eczema, or even a bad heat rash. Colloidal oatmeal works best.
I've heard about coconut oil, too.
Yes, coconut oil is a great natural moisturizer, and it has some mild antibacterial and anti-inflammatory properties, which can be helpful.
And surprisingly, breast milk comes up.
It does. For very mild rashes, like a little baby acne or irritation around the mouth, dabbing a bit of breast milk on it is sometimes suggested due to its natural antibodies and healing components. Can't hurt to try.
Interesting. What about keeping areas dry, like those skin folds? You mentioned avoiding talcum powder.
Yes, definitely avoid talc because of the inhalation risk. But plain cornstarch can be used sparingly to help absorb moisture in folds, just a very light dusting.
And cool compresses.
Great for calming down hot, inflamed rashes like heat rash or hives. Just a cool, damp cloth applied gently can reduce swelling and feel soothing.
So if we boil down prevention, what's the core message? The main takeaway for keeping baby skin happy?
It really comes down to gentle, consistent care. Maintain good hygiene, but use mild, fragrance-free soaps and don't bathe them excessively, which can dry out the skin.
Dress them appropriately.
Yes, choose loose-fitting, breathable fabrics like cotton. Avoid overheating.
Moisturize.
Absolutely. Keep the skin well moisturized, especially after baths, using a fragrance-free emollient. This supports that crucial skin barrier.
And just generally protect the skin from known irritants.
Right. Keep an eye out for excess moisture from drool or sweat, protect the diaper area, and use those gentle products we talked about. Regular monitoring helps catch things early.
What about over-the-counter stuff from the pharmacy? When might that be appropriate?
Well, for diaper rash, those zinc oxide or petroleum jelly barrier creams are your first line of defense, definitely OTC.
Okay.
For mild itchy rashes, like mild eczema, a low-strength hydrocortisone cream like 0.5% or 1% can sometimes be recommended by a doctor or pharmacist for short-term use to calm inflammation, but you really want to check with a doctor first, especially for babies.
Good caution there. Anything else?
Calamine lotion is an old standby that can help dry out and soothe some rashes, like heat rash or sometimes chickenpox blisters, though less common now with vaccines.
Okay. Now the crucial part. When to stop trying home care and call the doctor, or even seek urgent care? What are the red flags?
This is vital. First, look for signs of infection setting in. If a rash looks like it's getting worse instead of better, if the redness is spreading rapidly, if it becomes very swollen, starts oozing yellow pus, develops crusting, or has a foul odor, those are infection signs.
And if the baby seems unwell overall?
Yes, definitely. If the rash is accompanied by a fever, or if the baby is unusually lethargic, irritable, or not feeding well, that warrants an immediate medical check.
What about allergic reactions?
A sudden, widespread rash like hives, especially if it comes with any difficulty breathing, wheezing, swelling of the face, lips, or tongue, or vomiting, that's potentially a severe allergic reaction, anaphylaxis, and it's a medical emergency. Call for help immediately.
Okay. Emergency signs noted.
Yeah.
And you mentioned something earlier, a specific visual test, the don't blanch sign.
Yes, this is really important. Some serious illnesses can cause bleeding under the skin, which looks like tiny flat red or purple spots are called petechiae or purpura.
They look different from a typical bumpy rash.
Yes, they're flat. The key test is the blanch test, sometimes called the glass test. Press firmly on one of the spots, maybe with the side of a clear glass so you can see through it.
And what should happen?
Normal rashes or red skin will turn white, blanch, when you press on them, and the color returns when you release pressure. If these purple spots do not turn white when pressed, if they stay purple, it means it's likely bleeding under the skin.
And that's serious.
That can be a sign of very serious conditions, like meningitis or certain blood disorders. It needs urgent medical evaluation immediately. Don't wait.
Wow. Okay, that is incredibly valuable information. So wrapping this all up, what's the big picture for our listeners dealing with baby rashes?
The big picture is that while yes, baby rashes are super common and can be worrying, most are manageable. Understanding the likely type, paying attention to whether it's itchy or not, and focusing on that gentle, protective skincare, keeping skin clean, dry, moisturized, and protected with barriers goes a very long way.
So knowledge really is power here. It helps you stay calm and take the right steps.
Exactly. And knowing those red flags ensures you seek help promptly when it's truly needed.
It really highlights how understanding the unique nature of baby skin, how thin and delicate it is fundamental. We talked a lot about the obvious triggers like wetness and heat, but it makes you think. Given how reactive that skin is, what about the less obvious things? Those almost invisible ingredients in everyday products, lotions, soaps, detergents, maybe even air fresheners in the home. Could that constant low-level exposure be subtly undermining the baby's skin barrier development over the long term? Something to consider beyond the immediate rash.
That's a really interesting point, focusing on minimizing those exposures, choosing simple, fragrance-free, dye-free options whenever possible. It's likely beneficial not just for preventing rashes now, but for supporting healthy skin development overall.